Hi, I'm Mary Michaels, and welcome to the Live Well Health Feed, the health show designed to feed your mind with helpful health information. So I'm really excited today to introduce you to my special guest, Dr. Charles Chima, who is our new Public Health Director for the City of Sioux Falls. So welcome, Dr. Chima. Thank you for joining us today. We're really excited to learn a little bit more about you and just to share some helpful information with the community. So let's start with the basic question. What does a Public Health Director do?
Thank you, Mary. Glad to be with you this morning. And that's a very important question, right? And to really understand that, I think it's to ask the broader question, which is, what does the health department do? Because really the work of the health director is to help the department succeed in accomplishing its mission. So as a department, I think the easiest way for me to kind of help people understand what we do as a department, think about what your doctor is to you as a person, as an individual, right? You know, think about what your primary care doctor does for you, which is really to help you assess where your health is and to kind of help you optimize your health to see the best decisions that can be made, whether it's in terms of preventive measures or in terms of any issues going on that need to be addressed to see that you have the best health possible. And that's essentially what we do for the community, is we assess the health of the community and we kind of try to understand where our community is and to understand the things that we need to do to improve the health and well-being of our community. So we have different tools, just like the doctor has, you know, his investigative tools to be able to determine where your health is. We have different tools that we use. So we assess, we monitor, we diagnose, and based on what we learn, you know, what at times we may need to do primary data collection, but also we have a lot of secondary existing data sources that tells us, you know, gives us a pulse on how our health is doing as a community. And then we bring together partners. So once we understand, you know, whatever the topic is, we bring together partners, we communicate, we educate, right? And then when necessary, we advocate for new policies when we think there's a need to implement a new measure. We advocate for the community as a whole for more resources for health, and we empower residents to understand how the different choices we make in a given day ultimately results in better or worse health for our community. So that's really where we come in, is to be that voice for health, to be that advocate, to diagnose, to investigate, and to rally partners, to educate really, and to provide that direction.
Yeah. So really it's looking at the community as our patient. And really just kind of taking care of that whole patient, no matter what the issue might be. And I think a lot of people are familiar about the health department. You know, they know about Falls Community Health, our community health center. They know that we spray for mosquitoes. But we know when it comes to the health of individuals or the health of a community, there's so many factors that can impact our health that we don't necessarily think about every day. And so I know that you have extensive training in the area of population health. So let's talk about that term a little bit, population health. What's an easy way to explain what that means?
So one way to look at it is the literal meaning, right? So population health is really, you know, one literal meaning is to look at it, instead of saying the health of a population, it's just a shorter way of saying population health, right? So what it is think about aggregate health. So at the individual, again, go back to that earlier example, at the individual level, you understand your health as a person, you know, whether you're dealing with a particular disease. But as a community, how are we doing as a community? So that community in this case is Sioux Falls, right? But a community could also be smaller populations. It could be a demographic group. It could be children, right? It could be the elderly or the aged. It could be people that receive their care from a particular healthcare facility. So you can define a population in so many ways. It could be people that work for a particular employer or that are insured by a particular health plan. So whatever your population is, what's the aggregate health of that population, and how is that health distributed? So knowing that there are disparities, so which means there are differences in health, even in any given population. Everybody doesn't have exactly the same health status. So you think about the averages of the health of the population as a whole, but you recognize that there are quite some gaps, you know, and differences in health within every given population. So that's kind of a simple way of understanding it, is the aggregate health of a community or a population. And so again, to kind of shed more light on some of the things we do. So when we understand the cell, so we do community diagnosis, we understand what the challenges are, and then we have a lot of measures. So you give an example, you talk about our mosquito control program, and that's one of the proactive ways when we identify that these mosquitoes carry West Nile viruses, they carry other mosquito-borne diseases, right? So what can we do as a community to prevent them from even biting in the first place, so that we don't have to, deal with it at the treatment, having to provide treatment services. So we do a lot of proactive measures, which is to control the mosquito population and to reduce that nuisance, but also to reduce the negative health consequences of having those mosquito bites. We do code enforcement, right? We supervise daycares to see that when you have your child in a say home daycare facility, for instance, that you can be confident that your child is receiving adequate care and has been taken care of. We prepare the community to respond to emergencies, health emergencies, and also public health emergencies like the coronavirus, pandemic that we're dealing with right now, right? And we provide equitable access to healthcare services. So to see that irrespective of your income status, right, or whether you're employed or not, that everyone has a fair opportunity to have access to primary care services, including behavioral and dental services. And that's why we have Falls Community Health. So really, we are there to see that every member of our community has a fair opportunity to receive primary care.
And I think that's a really good term for the community to understand, is that topic of health equity, that we all have that equal opportunity to thrive. And we know from previous health assessments and looking at life expectancies in our own community, it might vary based on where you live in town. And there's so many things that impact that. And people don't necessarily think about housing or transportation, for example, as health factors, but they really are. And so I think that's great to really look at that community as a whole and look at what are all those different factors that impact health. And you talked about COVID. Obviously, that's been a popular topic for the last year and a half. But it's something we still need to be aware of. And so what are some of the messages that you really want the community to know right now as we continue to deal with the coronavirus?
Yes, I know that word COVID is something we don't want to hear about anymore. We're so tired of it. We want it to be in the past. And it can be in the past, and we're kind of getting there, right? But we need to do it, to hang in there, right? And just persevere to the end of this. So the good thing is, we're lucky, because when I say lucky, it's sort of record setting, right, to have a vaccine against such a new disease in a record time. So we are privileged to be living in an era where there is so much advancement in science and technology that we're able to mount such a quick response to a new health threat. So, but one thing that we're also seeing is that our level of uptake of the vaccines has not been at the rate that we need to really beat this thing for the long term. So we need to do more, which is particularly around the vaccine. So I think the most important message I'd like to put across is that the way out of this pandemic is through vaccination. We have the tool. We just have to adopt the right tool to beat this pandemic, knowing that from what we've seen, majority of the people that have been hospitalized and eventually died from this disease this year have been those that are not vaccinated. So we are very lucky to be living in an era where we have that infrastructure to be able to develop this vaccine and deploy it to make it widely available in such a short time. They're very safe and effective, and it's now up to us now to step up, do the right thing, get a vaccine, and kind of help us as a community to beat this.
Yeah, and right now they're so widely available, whether it's with your own healthcare provider or at local pharmacies, that many places you can just walk in and get that vaccine. And I think the thing that maybe is helping people along now too is there is an FDA approved vaccine, and so people can be confident that the vaccines when they first came out were already tested to be safe and effective, but now we have that added confidence booster with FDA approval. And it's really important kind of in light of this Delta variant, right? I mean, talk a little bit about that variant and why it is so important for people to really consider taking that step to be vaccinated.
Yes, you're right. So, whereas last year, right, when this disease, it kind of emerged newly, there was a lot of unknown and there was a lot of uncertainty. But we also knew earlier on last year that, those that underlying chronic diseases, the aged and elderly were kind of, the most vulnerable So, but a lot has changed. So part of what has changed is that viruses mutate. So that's what viruses do. It's just in their nature to mutate. And so what has happened is that we have a different predominant strain of the virus that is circulating right now. Now that's the predominant strain in the US, called the Delta variant. This variant is kind of a bit different in characteristic from the original virus. So what has happened is it's much more transmissible. So whereas before, people might say one person infected might infect just a couple of people, but with this new strain, a single person could infect as much as 10 people, depending on, the circumstances.
Wow.
So it's much more transmissible, right? And so because of that, we need to continue to put in place measures to reduce the transmission so that we can get out of this earlier. But the vaccine has proven very effective even against the variant, particularly around preventing severe disease. So even though with the new variant, the disease is spreading much more rapidly, but if you're vaccinated, you're much less likely to end up in the hospital or to die from this disease. That's why we keep emphasizing the value of vaccination in between this variant.
Yeah, and it's important too, not only for ourselves, but there are still segments of our population who cannot be vaccinated, whether they're under 12 years of age, or maybe they have another medical condition that simply does not allow them to be vaccinated, even if they wanted to be. And so it's not just about yourself, it's also about protecting your friends, your family members, your children even, to get through this pandemic.
And that's one thing about infectious diseases, right? We cannot beat this without coming together as a community. You don't say, I only care about myself. Well, if we care, if we focus on that individual approach, we're not going to get through this as a community. Because what happens is, it doesn't matter what you do as an individual if we are not all working together to beat this. Because you're going to get exposed. It's not within your control whether you get exposed or not, because once you're out there in the community, there's the chances that you'll be exposed. So that's why it's important that we consider others in our approach to this pandemic. You're right about that. There are people who, children, for example, under the age of 12, who don't have the opportunity to get vaccinated right now. But we can still provide them indirect protection, because what happens is when the vaccination rates are high, then there is that community protection that is in place that reduces the transmissibility of the virus, where essentially it has fewer places to go because it comes into a community and it meets a lot of barriers by seeing that a lot of people are already vaccinated, and it has fewer people to infect. So we can help protect those that are not eligible for vaccination by getting the shots ourselves.
Yeah, I think it's a lot of things like we do every day. We don't necessarily think about the fact that we have speed limits, and so we as individual drivers should follow the speed limit, but that also protects the people who are driving around us. So I think that's a great way to really try to think about some of these very complex illnesses and diseases, whether it's heart disease or cancer. I mean, the things that you can do yourself that eventually could help inspire others to be healthier and to take some of those precautions. So we're talking today with Dr. Charles Chima, the Public Health Director for the City of Sioux Falls. We're going to take a quick break, and when we get back, we're going to switch the conversation away from COVID and just a little bit about Dr. Chima. So stay with us. We'll be right back.
How do we end this pandemic? Well, vaccines are the very best tools we have. Researchers and scientists have used a gold standard process to ensure the vaccine for COVID-19 is safe and effective. The same strict guidelines required by the FDA to license all vaccines in the U.S. have been followed. Do your part to keep your family and community safe. Getting vaccinated will help end this pandemic so we can get back to normal. For more, visit covid.sd.gov.
Welcome back to the Live Well Health Feed. I'm Mary Michaels, and with me today is Dr. Charles Chima, the Public Health Director for the City of Sioux Falls. So, Dr. Chima, you are new to our community, and so we just want to take a little opportunity for the community to get to know you a little bit better. And so, you're not a Sioux Falls native, not even a South Dakota native. So, talk a little bit about your journey that brought you here.
Yes. So, prior to this position, I was at the University Medical Center, was a faculty, so I was, working with students, helping develop and lead some graduate training programs in population health. And it was a very, enjoyable work, because I really, one of the things I enjoy is just teaching, helping the next generation to be ready to help us, design a better healthcare system. And but then the pandemic came, all right, and I found myself, so I have training in public health also, I trained as a medical doctor in Nigeria, so I have that clinical background as well, and I could see the different dimensions of of how the COVID pandemic was impacting health and well-being as a whole in the U.S. And in many ways, I just inside of me, I'm an action-oriented person. I'm a doer. So more and more, as I was in the classroom during the pandemic, I felt the need to just go back to the front lines because I could see a lot of ways that I could put my training and knowledge to good use in helping us build back better and just respond more effectively to this pandemic. So I felt that urge to go back to the front lines, and I was lucky to find this opportunity to help lead our health department here in Sioux Falls, and it's just been a pleasurable experience since then.
Yeah, I mean, such a diverse background that you have. As you mentioned, you were trained as a medical doctor in Nigeria. You have advanced studies from London and from universities here in the United States. So obviously there's something driving you to get into this kind of a field, whether it's on the clinical side of health, but also certainly the public health. So what is it that kind of drives you, or what is that vision that you have?
Thanks for asking that, and I think the best way for me to answer that would be to reflect on. So recently I had the opportunity to participate in a values mapping exercise that kind of really helped me question, get to the core of who I am as a person and why do I do the things that I do and why do they matter to me. And so one of the things, so if you don't mind, I'd like to share some insights.
Absolutely, please
from that assessment. So one of the things that I found was a core value for me was making a difference, and that's something that has been part of my person from a young age. So even as a medical student, I recall being very frustrated with some of the things I witnessed with regards to having patients die from things that I know are preventable. All right, so it was very frustrating to me. That's part of why I decided I was going to be a public health physician, because I wanted to go a bit more upstream to address some of those societal factors that I felt we are standing in between the people that we are seeing in the clinic and the ability to get well. So I think we have the obligation as humans to leave this world a better place than we met it. And so for me, making a difference, and I think leading a health department, working with the great talent we have in the department and in the rest of the city government is a great way to do that, really to help our community achieve the best health possible than it can. The other thing that, so ethics is another thing that I found is very important to me. And for me, ethics is simply, doing the right thing. Doing the right thing always. There's no, always, and even when no one is watching, right? Always doing the right thing, and that's important, especially in the kind of line of work of public health, right? Because oftentimes, we face a lot of pressures, and people have very strongly held opinions about how, with the direction we should move as a society. But you have to always ask yourself, what is the right thing? What does the fact say? What does the data say? What is the evidence, right? So doing the right thing is something that I consider important. And also excellence, and thinking about it. So while I think of ethics as doing the right thing, I think of excellence as doing the right things, right, and doing them well. So doing anything you set your hands to do it to the best of your God-given abilities, and just do it well. And that's part of why I sought out doctoral training in public health, because I already had that medical education. I didn't need another title to be a doctor. But I felt that if I was going to be a very effective public health practitioner, then I needed a bit more advanced training than what medical education offered. That's why I sought the opportunity to do a master's and take it all the way to a doctorate, because I really wanted to have the skills to be able to do the job that I sought to do, and to do it well. I also found out that I value very much being open-minded. And I think that's really important in public health, because you have to recognize that to learn to respect diversity of opinions, right? To see things from different perspectives, and know that there is no monopoly of knowledge, right? That you're an expert in something doesn't mean that you know everything, or that you've considered all the possible facts that need to be considered, or different possible perspectives that need to be put into consideration. So I think being open-minded helps us to make the best use of our diversity, and see differences in opinions, and see where we can find a consensus, and the best ways that we can move forward as a community. And the last thing I would like to reflect on and talk about is well-being. So that's an important term, right? That's kind of loaded, right? But I think at the core of it is recognizing that without health we are nothing. Ultimately, all the things we desire to enjoy in life, health is at the center of it. You can have all the money, all the resources, but if you're unhealthy, then you don't have that enabling environment to enjoy all the good things that life has to offer. So I think we have an obligation to see that every resident of our community has the best opportunity possible to achieve the best health that they can.
Yeah, well, that's speaking my language. We know with Live Well Sioux Falls, that's really what we're all about, is helping people understand what it is that makes them healthy and shaping our community in a way that affords them that opportunity to be healthy. And I like what you said about being kind of the open-minded and that focus on well-being, because we're unique in Sioux Falls that we have a local health department. There isn't another city in our state that has a local department. So for us to be kind of embedded in city government where we can work with our partners, whether that's the people who are building our streets or taking care of our parks or running the libraries, that there's a place for health in all of those discussions. And so appreciate that energy and vision you're bringing to move that forward. And so our final questions today are really tough questions, but these are the ones that people really get to learn about you. So you obviously have come from a lot of different places and have had lots of experiences. So what's your favorite food?
And that is the most difficult question for me to answer, honestly. Because when it comes to food, I'm very open-minded when it comes to food. I like to try new things, and really, from me, I've had the opportunity to be part of different cultures, right? Whether it's in my native African continent, or whether it's in Europe, whether it's in Houston, which it's a different world from here in Sioux Falls, right? So I think, and then the great thing about the Southern hospitality, having lived in Mississippi, so I've just been privileged to be exposed to different cultures and different great food really, and so I'm very open-minded when it comes to food.
So obviously we preach good health and good nutrition, but is there like a favorite cheap junk food that you have? Like, if you're going to treat yourself, what do you have?
So that'll probably be maybe ice cream.
Oh yeah, there we go. That's always a good one. It doesn't matter whether it's cold or hot. That's always a good one. So I know you have a family. So what are some of the things that you and your family like to do to be active?
Yeah, so and that's one thing. Modern lifestyle, right, really kind of gets in the way of being active, right? Oftentimes we spend a lot of time on our computers and in cars, and just the modern lifestyle makes it so difficult to be physically active. But we know also that that's one of the most important things you can do to be healthy, is to see that you have a physically active life. So how I approach that is, I try to build that into my daily routine. Because I know, it's very challenging to find that time. Maybe at the end of work, you're so tired. Not everyone is super motivated to go to the gym and work out at the end of the day. So what I do is try to build it into my daily routine. When I can walk to a meeting, I do that, right? So avoid walk when you can, and limit the driving to really essential. And if you're in a building and you can take the steps, do that, absolutely, right? If you can mow your own lawn, do that. If you can shovel your own snow. So
and that's coming.
Yes.
That's something that you're going to get to experience in South Dakota.
Yes, absolutely. So as much as it's terrifying, right, to think about how much snow we have here, but I also look forward to it from that point of just see it as another opportunity to be more physically active. So really, that's for me how I beat it, and I know it works for a lot of people. Is find those activities, chores, or part of your daily routine where you can build in physical activity, and that way it doesn't become something additional that you have to make out time for. It just becomes part of your day to be physically active.
And you'll get to experience all of that fun and the joy of going out with kids and building a snowman here in South Dakota. So that'll be a great experience for you. Well, we appreciate your time. We appreciate your leadership and being here to take care of our patient, to take care of Sioux Falls, and we look forward to all the great things that are to come. And so if you're ever looking for any health information, whether it's a new healthy recipe, some tips for being active, links to help you quit tobacco, whatever it may be, please visit our website, livewellsiouxfalls.org, and follow us on Facebook, Twitter, and Instagram to keep up with everything that's going on. And so what's just kind of one last message that you would like to share with the community residents in terms of being healthy?
Yeah, I think, again, health is holistic, right? So we shouldn't just think about health from one from one perspective. It's everything we do, so in terms of to avoid things that we know are harmful to our health, but also to take preventive measures like getting your vaccination. So think about the flu season is coming, right? It's important to get our flu shots because we know that flu can be serious. So get your flu shots. If you're not yet vaccinated against coronavirus, please get the COVID vaccines. It will go a long way to protect you as an individual, but to protect our community as a whole. So keep your primary care appointments and do those things that will help us to have a healthy fall.
Great words of advice. So thanks so much for joining us. Please take care and join us next time for the Live Well Health Feed.